Neil, welcome to Biotech and Money's HealthEx Forum. Firstly, can you tell me why you decided to give up time to attend today?
I think it's always useful to be part of a forum where you've got your peers present. There's a very strong group of chief exec and chief financial officers here today, and it's useful to be able to have that level of interaction with people, and frankly, you don't get that very often.
Terrific, thank you. Now Neil, you've raised 13 million from high net worths, more than 10 million in regional growth fund cash, and you've successfully listed on AIM. So why were investors so happy to pay up?
As ever, I think they like the story. I think they like the breadth of opportunity that we represent. We've got a very broad pipeline, 13 programs across cancer and infection, and we've just launched an immunology subsidiary. And I think they like the potential returns that come from that. We're active in very hot sectors in cancer, in tumour immunology and cancer stem cells. And antimicrobial resistance is a big challenge for all of us, and there's an increasing commercial appetite in that area as well. So I think ultimately they like the potential that the company represents.
Excellent. And which do you think is the biggest opportunity, disruptor or game changer for the sector that you see coming in the next 12 or so months?
For the sector, I mean, particularly in cancer, there's a lot of talk around tumour immunology approaches. We all know about what's going on with CAR T on the biologic side, but also small molecule approaches such as we're involved in. You know, there are very high valuations around those, and delivering on the promise of those technologies, I think, is potentially very disruptive for therapy in that area.
Okay. And obviously this is a forum for CEOs of life science companies. So what, in your mind, is the biggest challenge that life science CEOs face in today's healthcare sector?
It's always delivery. Whatever sector or whatever company you're in as a CEO, the biggest challenge is always delivering on what you've told your investors you're going to do, and then growing your business on the back of that.
Okay. And if we look at the healthcare sector as a whole, and in terms of investment in the UK, what is your outlook for healthcare investment in the UK in the coming months and years?
I'd like to think that there is an increasingly positive trend around that, but clearly, as we've been hearing today, you know, there are big differences between the investment climate in the US for biotech and the investment climate in the UK. The UK market is very different to the US market, both in the availability of capital and the makeup of the investor base here. I'd like to think that investors in the UK are getting more comfortable with biotech again, and I'd like to see that improve. But you know, we need. There's a lot of reliance on people like Neil Woodford right now to cornerstone investments. We need other investors to step up and play a similar kind of role that's going to give us the breadth in the UK market that allows companies to prosper.
Excellent. Neil, thank you for your time.